Let's be honest, nursing theories can sometimes feel, well, a little abstract, right? Especially when you're in the middle of a hectic shift. But today, we're going to demystify one of the big ones, the Roy Adaptation Model. My goal is to make this an easy, powerful tool you can start using right away. And before we jump in, just a quick and a very special thank you to Dr. Abdul Karim. Now remember, this explainer is meant to be a sidekick to your main learning. It's here to support what you're doing in class, not replace it.
All right, here's our game plan. We're going to start with the why theory even matters. Then we'll introduce the model itself, break down its core ideas, and the 4 adaptive modes. And then, and this is the best part, we'll see exactly how it works in the real world, both at the bedside and in research.
Okay, first up, let's ground ourselves in reality. Why should you, a busy nurse, care about theory when you're already juggling so much?
It's a totally fair question. I mean, when you're running around, charting, dealing with complex patient needs, who has time for theory? But here's the thing. The very pressures we face every single day are exactly why having a solid framework is so incredibly important. And look at this list. These aren't just vague feelings. They are real, documented phenomena that take a heavy toll. We're talking about compassion fatigue, burnout, moral distress. These things impact our well-being, nurse retention. And you know what? They ultimately impact patient care.
And this is where theory becomes our ally. We need a framework, almost like a GPS, to help us navigate all this complexity with a clear sense of purpose. This quote really hits the nail on the head. The Roy Adaptation Model, or RAM as we'll call it, gives us that GPS. It shifts our focus from just, taking off tasks on a list to something much bigger, helping our patients actually adapt to their health challenges.
So, how does this thing work? Well, it's actually pretty simple. It all boils down to 2 core concepts. Let's pop the hood and see what makes this engine run. First up, stimuli. That's a fancy word for all the stuff. The events, the conditions, the circumstances that a patient is dealing with. Think of it as every single piece of data their brain and body are trying to process at once.
And this is where it gets super practical. The model breaks stimuli into 3 types. The focal stimulus is the main event, right? The cancer diagnosis itself. Then you have contextual stimuli, all the other stuff going on, like the pain from surgery or worrying about hair loss. And then there's residual stimuli. These are the underlying beliefs or past experiences, like a fear of getting addicted to pain meds. A great nurse learns to see all 3.
All right, so that was concept number 1. Concept number 2 is coping processes. So if stimuli are all the data coming in, coping processes are the patient's internal software for dealing with all that data. It's how they manage it all. Now, for an individual patient, the model splits this into 2 things. The regulator is the automatic stuff, your body releasing stress hormones without you even thinking about it. The cognator is the thinking part. Problem solving, emotions, all of that. The model also looks at groups, but for bedside care, that regulator and cognator distinction is really key. Okay, so we get it. Patients are dealing with stimuli and they're using coping processes. But where exactly do we look to see how well they're adapting? Well, RAM gives us 4 specific areas or modes to guide our assessment. Think of these 4 modes as your complete holistic assessment checklist. They guarantee you're looking at the whole person, not just the physical problem that brought them into the hospital. First up is the physiologic mode. This is our bread and butter, right? The body's physical and chemical workings. We're talking oxygenation, nutrition, all the stuff we're already great at assessing. The goal here is physiologic integrity. Simple. Second, we have the self-concept mode. Now we're digging deeper. How is this illness affecting who they are as a person? We're looking at their body image, their sense of self, their beliefs. The goal is their mental and spiritual well-being. Third is the role-function mode. Getting sick can turn your life upside down. Is this person still able to be a parent, a teacher, a spouse? We're assessing how their roles in society are being affected. We're aiming for social integrity. And finally, we have the interdependence mode. This is all about connection. Who are their people? What does their support system look like? It's about their close relationships and their ability to give and receive love and support. Okay, that's all the theory, but what does this actually look like on a busy unit with a real patient? Let's walk through a case study and see this model in action. And the beautiful thing is, you don't have to throw out the nursing process you already know and love.
RAM fits right into it. The only difference is that your assessment is now supercharged. You're specifically looking for stimuli and assessing those 4 modes.
Now just look at how powerful this is. The nurse doesn't just focus on the surgical site. In the physiologic mode, yes, she addresses the arm pain with an exercise plan, but then she moves to self-concept and addresses the patient's fear about hair loss. Then to role function, helping her figure out work and home life. And finally to interdependence, by supporting her and her family's relationships. See? It's a complete person-centered plan of care, not just a symptom-centered one.
And the value of this model doesn't stop at the bedside. It's also a fantastic framework for nursing research, which is how we build the evidence that makes our whole profession stronger. Researchers use RAM to design their studies. For instance, it was the backbone of a program called T for the Soul, which was created to help nurses adapt to their own workplace stress. How amazing is that? This is theory being used to find real solutions for us, the caregivers.
So, what's the bottom line here? RAM isn't just another theory to memorize for a test. It's a truly useful framework that gives us a common language and a shared structure to guide everything we do, from practice to research to education. So, I'll leave you with this question to think about. The next time you walk into a patient's room, how might this change what you see? Beyond their diagnoses, what focal, contextual, or even residual stimuli might you notice? Which of the 4 modes will you be thinking about? Give it a try. It can absolutely transform your practice. Thanks for joining me.